Throughout human history, infectious diseases have posed one of our greatest challenges, shaping societies and guiding public health strategies. In this educational series, we delve into the world of infectious disease control, understanding preventive measures and exploring strides in public health. In this first segment, we will provide an overview of infectious diseases and the significance of controlling them. By unraveling the complexities of pathogens and examining methods to combat their spread, we aim to set the stage for understanding a crucial aspect of public health. As we move forward, you'll see how history has informed our current practices and how today's innovations promise a healthier tomorrow. The battle against infectious diseases has been relentless. Early on, humanity realized the need for public health measures like sanitation practices, waste management, and clean water supply to prevent disease spread. These effective measures marked the dawn of organized public health efforts. A groundbreaking advancement was the development of vaccines. Edward Jenner's smallpox vaccine in the 18th century laid the foundation for modern vaccination programs. These early efforts represented a monumental leap toward disease control. Today, sanitation and vaccination principles remain fundamental. Moving forward, we'll explore how these early efforts evolved into contemporary disease prevention methods. Vaccination stands as a monumental achievement in public health history. Modern vaccines have evolved dramatically, becoming a cornerstone in our fight against infectious diseases. From rudimentary inoculations to sophisticated immunizations, vaccines have curbed the spread of illnesses and saved millions of lives. Global vaccination campaigns eradicated diseases like smallpox and significantly reduced polio and measles. The evolution of vaccination reflects mankind's persistent battle against pathogens and the crucial importance of scientific innovation. As we marvel at these accomplishments, we will next delve into the critical roles of sanitation and hygiene in disease prevention. Stay tuned to discover how these practices continue to safeguard public health. Sanitation and hygiene have always been vital in battling infectious diseases. Clean water and waste management have been public health cornerstones since ancient times. With societal advancements, so too has our understanding of how sanitation prevents illness. Modern hygiene practices, like regular hand washing and disinfection, have significantly reduced infections. Today, public health initiatives focus on providing sanitary facilities and promoting hygiene globally to prevent outbreaks and ensure healthier communities. Moving forward, integrating sanitation and hygiene in public health strategies will remain indispensable. In today's healthcare landscape, infection prevention and control are paramount. Modern methods ensure the safety of patients and healthcare workers. From meticulous hand hygiene protocols to personal protective equipment, best practices are rigorously followed to minimize infection risks. Hospitals and clinics utilize advanced sterilization techniques, continuous training, and robust policies to tackle healthcare-associated infections. These comprehensive measures encompass both routine sanitation and strategic isolation protocols. As we move forward in our discussion, you'll see how modern approaches intersect with surveillance and early detection, further fortifying our defenses against infectious diseases. In today's interconnected world, surveillance and early detection are our first line of defense against infectious disease outbreaks. These steps help identify potential threats swiftly, enabling rapid containment. Technologies like big data analytics and AI-driven systems revolutionize real-time monitoring and detection. By tracking disease activity continuously, we can spot anomalies indicating emerging threats. Surveillance aids early detection and informs public health strategies and interventions. This proactive approach minimizes outbreak impact and protects global public health. Moving forward, we'll delve into the vital role of contact tracing in managing infectious diseases. Contact tracing is a critical component in combating infectious diseases. It involves identifying individuals who have contacted an infected person and notifying them of potential exposure to allow isolation and prevent further spread. Effective contact tracing relies on a quick, systematic approach, often involving digital tools and extensive data analysis. This process pinpoints outbreak locations, allowing prompt public health intervention. Successful contact tracing has repeatedly reduced transmission rates. As we move forward, you'll see how isolation and quarantine complement contact tracing, forming a comprehensive disease control strategy. Isolation and quarantine are essential practices in the fight against infectious diseases. While often used interchangeably, they serve distinct purposes. Isolation separates those infected from those not infected, preventing disease spread. Quarantine restricts the movement of individuals who may have been exposed but are not yet ill. Prompt implementation during outbreaks significantly reduces transmission rates. Historically, from ancient times to modern outbreaks, isolation and quarantine have proven effective in curtailing disease spread. As public health professionals continue to refine these practices, understanding their importance and proper implementation can make a pivotal difference in disease control. Let's look at a successful case study where public health measures effectively controlled an infectious disease. During the Ebola outbreak in West Africa, coordinated efforts were critical in managing the crisis. Rapid response teams, community engagement, and robust contact tracing played pivotal roles. Early detection through surveillance systems enabled swift case isolation, drastically reducing transmission rates. Public health officials tirelessly educated communities about preventive practices. These measures, coupled with international support, significantly curbed the virus's spread. This initiative underscores the importance of a multifaceted approach, integrating vaccination, hygiene practices, and quarantine protocols. During an infectious disease outbreak, public health officials face significant challenges, from limited resources to widespread fear and misinformation. Yet, adversity often leads to innovation. Authorities devised groundbreaking solutions, such as enhanced surveillance, community engagement, and rapid response strategies to address these challenges. Each step taken was a bold move toward controlling the disease, showcasing public health systems' resilience. These innovations not only stemmed infection, but also established frameworks for future responses. Reflecting on these solutions highlights the importance of continuous innovation in public health crises and provides a roadmap for handling future threats. In summary, we've seen remarkable strides in controlling and preventing infectious diseases. From sanitation efforts and early vaccinations to advanced surveillance and contact tracing, the journey involves continuous improvement. New challenges bring innovative solutions. Technologies like AI diagnostics and personalized medicine promise to revolutionize combating infectious diseases. Public health professionals, researchers, and communities must collaborate to leverage these advancements. Together, we can ensure a healthier future where infectious diseases are swiftly identified and controlled. Stay informed and vigilant, and contribute to a future free from infectious disease threats.